Good afternoon. Can you hear me okay? Good afternoon. I am joined today by Chief of Health and Human Services, Marty Martinez, and other members of my team. And I want folks to know that there is no higher priority in my administration than the equitable recovery from this pandemic. I have maintained an unrelenting focus on addressing the impacts of COVID-19 with testing, vaccination, and public health policies that are informed by data. The latest data show encouraging trends. Over the past 2 weeks, confirmed cases of COVID-19 in Boston have dropped 38%. We saw an average of 80.1 new positive cases per day in the city, which is below the threshold of 339.7 cases per day. When it comes to testing, the positivity rate decreased by 1.3 points over the past 2 weeks to 2.4% citywide. In each neighborhood, positivity was under the 4.3%, less than the 5% positivity threshold. The total number of COVID tests conducted in Boston remains stable at 2,960 tests, a decrease of 1% in the past week. There is also encouraging news in our hospitals. COVID-related ER visits decreased by 6% over a 2-week period, and the percentage of occupied non-surgical ICU beds is at 91%, under the threshold of 95%. We currently have 75 COVID patients in our Boston hospitals. That is one of the lowest numbers recorded since the start of the pandemic. In every neighborhood, more and more Boston residents are stepping up to get their COVID vaccine. More than 64% of all residents aged 16 and older have gotten at least one shot. And we are working hard to engage residents who have still not been vaccinated. As of this week, both the Reggie Lewis Center and the Heinz Convention Center are open for walk-up vaccinations, no appointment required. I've asked members of our business community to partner with us to promote vaccination among their employees and their customers. Through the $1.5 million I invested as mayor in the allocation for the Vaccine Equity Grant, 11 community-based organizations are now reaching our most vulnerable populations with vaccinations. And our Equity and Vaccine Access Hotline continues to connect residents in the hardest-hit populations with vaccine appointments. Boston residents over the age of 16 can call 635-5555 or visit boston.gov/getvaccinated. The success of Boston's public health recovery is essential to our city's reopening and renewal. Today, I am pleased to announce the planned expansion of in-person services here at Boston City Hall and the Boston Public Library System and the Boston Centers for Youth and Families. Starting June 7th, Boston City Hall will be open to the public by appointment 4 days a week, and residents will be able to book appointments online Mondays, Tuesdays, Thursdays, and Fridays. Please visit boston.gov to see all of the available in-person services and book your appointments. The Boston Public Library will also reopen for limited in-person services in June. All of our library locations will prioritize services that help residents with economic and educational recovery, along with summer programs for kids and adults. In addition, Boston Center for Youth and Families will align with the Phase 4, Step 1 of the Reopening Massachusetts Plan. This move will provide safe and accessible space for young residents and increase children's programming, including arts and crafts, fitness classes, and game nights. I'm excited to welcome back more residents in City Hall for the joy that our libraries and summer programs will bring. I am also grateful for the city employees who have pivoted throughout this pandemic to safely deliver critical services to the people of Boston. We are approaching the end of the toughest days fighting the COVID-19 pandemic. And I've asked my chiefs of Health and Human Services and Economic Development to take a look at accelerating Boston's reopening timeline in light of the improving public health metrics across all of Boston's communities. To make a full and equitable recovery from the pandemic, we must continue to do what works in the city of Boston, and that is wearing our masks, keeping our distance, washing our hands, and getting vaccinated. Working together, we can ensure Boston's reopening is a safe one. Thank you, and now I will take a couple of questions. Yes, in terms of the timeline, in terms of reopening, I have always been making decisions that are informed by data, doing what is best for our residents in terms of the public health strategy, understanding that our economic strategy is tied to the public health response and strategy, because we are seeing the data and that this data is trending in the right direction. We are looking at accelerating our timeline in terms of reopening in the city of Boston. Well, I certainly hope to make a decision around this in the coming days and perhaps next week.
Can you talk a little bit more about what goes into that thought process?
Well, we're looking at all 6 metrics that we look at. In all of those, we are seeing the data trend in the right direction. And so because of that, and we're seeing this over time, so it indicates that we are in a much stronger position to loosen some of the restrictions in terms of our timeline. As always, we have to be informed by the data and do what is best for the residents of Boston. So we are continuing to look at that closely, and we are working together. In addition to meeting and working with my own chiefs here at City Hall, have been working with the business community and as well as some of our public health partners externally on this.
There's been a lot of activity at Mass and Cass lately. State police are taking down tents that have been set up there recently. Is your administration planning anything new there?
So the question was on Mass and Cass, and I think the first thing that I would indicate that some of the challenges that individuals are facing are much more than a location. These are people who are in need of services and treatment. They're in need of compassion, and so we should avoid categorizing this as some geographic location in our city, but recognize that these are individuals who need help and support. In terms of our strategy moving forward under my administration, there is a refocus and reviewing what has been working and trying to build upon that, as well as making adjustments as needed. Certainly the Chief of Health and Human Services, as well as the Public Health Commission, are looking at this. This is a health issue, and it does require the partnership of public safety officials in our city. So we are doing a number of things, including a more intense focus in terms of our own coordination, in terms of our own strategy for short-term and long-term thinking. In terms of the long-term, there is still work being done in the capital plans to rebuild the recovery campus, and we are reviewing that in such a way that gets us away from just counting on a bridge, but how can we make the island sustainable in the future on its own so that ferry service is a viable option for us. This obviously is a very complex issue overall. Many continue to point their finger at what they see as a problem in our city, but not many are raising their hands to help out. And so this is a complex issue. We first and foremost want to make sure that we are connecting residents who need help, who need services, to those services and to that treatment.
Looking at moving away from the bridge and going to a ferry system?
No, I think the bridge is still very important, but as folks know, there has been a lot of discussion with our neighboring towns around the construction of a bridge. We will continue to push for the bridge to Long Island. I think that is definitely an important part of the strategy, but we also have to look at building the capacity on the island as another option to make the island self-sustaining in terms of our response. God forbid there be an emergency on the island. And so a ferry service is something that I've thought about for quite some time, but to do that we need to make sure that the island is self-sustaining in terms of its ability to respond should there be a crisis on the island. Thank you all very much. I appreciate your time today. Thank you, Harry. I appreciate you.